Part 10 on the series of chest pain I said I'll be talking about. Okay, so if you've not watched part 1 to part 9, please do well to watch those videos. So today we'll be talking about peptic ulcer disease. Just to let you know, this will conclude the series on chest pain, and I'll be moving forward to talk about the causes of abdominal pain. Okay, so for those meeting me for the first time, I am an emergency medicine physician. I see patients with acute and life-threatening illnesses every day. So back to peptic ulcer disease. What is peptic ulcer disease? The best way I can describe it is an injury on the lining of the stomach and upper part of the small intestine, which we call the duodenum. Okay, now when there's an injury in that line, mucosal lining, what are the symptoms that you present with? Typically, you present with a chest pain, but in the vast majority of cases, you present with upper abdominal pain, which we call epigastric pain. And how do you describe this pain? So this pain, you describe it as a peppery type of pain, not a sharp pain, not a dull pain. And you will always say that this pain radiates to the back. Now, when you have this kind of pain, you might be dealing with an ulcer. I know the next question in your mind will be, what are the causes of ulcer? Now, in vast majority of cases, more than 90% of cases, it is caused by a bacterial bug we call H. pylori. Also, for those who are on prolonged or chronic use of NSAIDs, such as ibuprofen, naproxen, diclofenac, and the likes, they can also present with ulcer. Okay, when you have these symptoms, all you need to do is to see a doctor. When you see a doctor, there is a test that will be conducted that will give an indication if you are dealing with H. pylori infection. So if this ulcer is caused by H. pylori infection, there's a medication that will be given to you. We call that the triple regimen, which constitutes a proton pump inhibitor and also antibiotics. So you will take this medication for some weeks, and this will help to solve the problem. Okay, now for those whose ulcer is caused by prolonged use of NSAID, you will talk to your doctor. So your doctor will likely change your medication. If you are taking this medication for pain, your doctor will likely change this medication to another type of pain medication, okay, and place you on maybe antacid or omeprazole just to heal that injury. Where I am interested in is not just the ulcer, but the complications of this ulcer. Okay, now if you don't treat this ulcer, it can lead to massive bleeding, and people have died from massive bleeding resulting from an ulcer. It can also lead to other complications. So it's important when you have this kind of pain, see a doctor and get this checked out. So I know you've learned something today. Please like, share, and comment, and I'll see you in the next video.